Hi there, I'm Dr. Gigi Shamus, and thank you so much for joining our webinar. We really look forward to talking about COVID-19, anxiety, and some aspects of PTSD as well. And it's presented by Five Branches University, which happens to be my alma mater and where I currently work. I'm a licensed acupuncturist and a doctor of natural health, and we'll be talking with Joanna Zhao, who was my academic dean at the time and still is the academic dean and the clinical director at Five Branches University. Of course, that's in San Jose and in Santa Cruz. Go ahead and grab yourself maybe a cup of tea. I have some mint and lavender, really good for anxiety and stress reduction. And we'll get started in just a minute. And you're always welcome to type your questions into the chat box so that we can answer them at the Q&A at the very end. This webinar will be recorded so we can share it with you later. Of course, COVID anxiety could include the anxiety we've all felt about this pandemic and how it's ravaged the world for the last year. And it also includes the fact that when people do catch COVID, they tend to have much higher levels of anxiety at that time and even afterward. So we wanted to address both of those things with 10 minutes of TCM, traditional Chinese medicine. So traditional Chinese medicine can be acupuncture, but it can be many other things, including herbs. It can be exercises you can do at home, nutritional advice, and so on. We are so sorry if the pandemic has affected you and your family and loved ones personally. And many of us have felt as though our lives are so different now, even if we have not been personally affected by COVID. So at this point in the pandemic, about 120 million people worldwide have caught COVID. Of those, 67 million have recovered, and unfortunately 2.6 million have died. And basically what we're looking at is how can we assist with Chinese medicine the high levels of anxiety, both from, of course, just living through a pandemic, and secondly, for those that have experienced the shortness of breath of COVID, the difficulty walking, the extreme fatigue, the malaise. What can we do to assist them? So as acupuncturists, there's certain points that we can needle to help our patients overcome their anxiety. And for lay people, there are certain points you can press on yourself at home that can have a wonderful effect, a very calming effect for your general well-being. And on a personal note, for those of us that have actually become parents in 2020, I hope that your anxiety has been manageable. I hope that the things that we talk about today can also further assist. Joanna received her education from Shanghai University in the People's Republic of China and has actually been leading tours back to China since 1992 for students at Five Branches. So we'll go ahead and pass this over to Joanna Zhao, who's going to share with us some pearls of wisdom from Chinese medicine.
Hi, my name is Joanna Zhao. I'm an acupuncturist and also Chinese herbal medicine doctor. And I practice in Five Branches University, being already in here 37 years. So this year, actually last year, 2020, everybody having a problem worried about the COVID-19. And many of you may already experienced. So we already know the COVID-19 symptoms. So I'm not going to introduce this in here today because it's been already 1 year, everybody knows. I wanted to emphasize is after COVID-19 disease. For example, some people after the COVID-19, we call post-COVID-19 syndrome. And I see some patients, they recovered or they may have not too much symptoms, but they still have some people no symptoms, some people having. For example, feel headache and dizziness and can't sleep well and brain fog, which is concentrate. And some of them are even having feeling like very tired and couldn't get up. And some just don't want to do any exercise. And also the severe one I saw one have a hallucination because couldn't concentrate. I have a patient who is a pharmacist. And she said after the COVID-19, she was okay for a while, but later she feels like she couldn't concentrate. So she actually called me and I did a telemedicine with her. So I found out she is very dry and also can't sleep well. Of course, if you don't sleep well, next day you won't feel good. And she said, I used to have insomnia sometimes, but not like this. This like I have fog in my head. So this is a one. And I have another patient who is just he said he's PTSD now because he's just worried and suddenly wake up at night and also doesn't want to do exercise. He used to do exercise every day. He said it's no energy. And also I have another patient who has short of breath. He thought after the COVID-19 he might, no short of breath, but he still have it. And walk up the hill, up the stairs. He said, I had to stop for a while, and hopefully the symptoms go away soon. And number 4 patients I have is headache, dizziness, and I saw her. She said she feels like going to faint. So all these symptoms, acupuncture herbs we can help. So I actually consult with them using some herbs and also some food. For example, turmeric, 姜黄 in Chinese medicine. Turmeric is a very good herb to reduce the inflammation. So all these symptoms actually is related with inflammation in the body. And some of them just need to get rid of that. So I would suggest you, tell your friend, or if you have these symptoms, tell them have a 姜黄, which is turmeric, and cook with it, or buy some tablets or powder to help to reduce symptoms. And also I want to emphasize one thing is for the young generations, because these people actually, we had to take care of them. They already found out if the symptoms, PTSD, whatever things come out, they grew up with a mask and grew up don't want to be too close to the people they don't know, and they grew up from not be social with people too much. So may will have some antisocial problem. So we had to take care of them. And also some of the children may doesn't like to talk to people, also is anti-social problem, right? So in Chinese medicine and acupuncture, we do treatment. For example, you can help your friends, your children also. For example, you can massage your ear. The whole ear actually is the points. We call distal treatment. The points you massage and you can get relaxed. And that is, you can do at home. Besides you have turmeric you can use, and this very good tool, we can do it. So for adults, for elderly, for young people, for the babies, we all have to take care. And another important part we thought is PTSD, which is after that big pandemic problem, many people think about, oh, I don't want to get it, I don't want to get. So they have the PTSD problem. And what we should do is we have lots herbs and acupuncture and also the food that they can use. For example, the best thing I tell people, pear. Pear is very good for the lungs and also for calm your spirit. So pear, you can cook the pear, you can eat as a fresh, you can steam it as a herbal, it's good food. So today I don't have too much time to talk about it. I just let you know, if you have any friends who has post-COVID-19 symptoms, you can always find the acupuncturist, the Chinese medicine doctor, or nutritionist to help them. And you also can use ear acupressure to help them too. Okay, thank you.
Thank you so much, everyone. And this is Dr. Gigi here. I hope you all can hear me okay. And I was going to ask Joanna a couple questions about what she's been personally doing for her own anxiety. And then we want to answer your questions. So go ahead and type any questions into the chat box. I'm noting where the chat box is. So go ahead and type any further questions that you have. And Joanna, to get started, I did want to ask you basically what you've been doing for your own self, and then I can talk a little bit about myself for our own anxiety as practitioners and just in everyday life.
Hello, everybody, and this is Joanna. Yeah, I'm very happy to be with you today, and special, beautiful. I know if you're in California, I'm in Santa Cruz. Beautiful sunny day. Talk about post-COVID anxiety, and of course, I have a lot thinking, and also as a practitioner, I even think about how to help people and I help myself. You know, for example, as a as an acupuncturist, I have so many. Suddenly, after a few months lockdown, and people started calling me, and what should I do? What should I do? How can I do? I don't get it, and how can I do if my friend, my family has it? So I also get a it's not a something anxiety to me. It's like nervous to not nervous, just to worried how to help people. Okay, so and also when we opened, I needed to see patients. Then I really had to tell our students and teachers how do we protect ourselves, not just the white coat. The white coat, the virus can get on your white coat and you still can get it. Of course, we use mask and we use good N95 mask and a very good mask, but still. So what I did is I have a goggle, I have a shield, and make me can't even breathe, right? But the but I have to protect myself. Then I also protect the patients and the staffs. So that is one of the not anxiety is the worry. Yeah. So what I do is I just first thing I tell you, really interesting, the deep breathing, because acupuncture we have, 12 channels. Like here is the, middle of the CV channel and the do channel, the governor channel. And you just do a deep breathing, and even you don't know how, I don't know how to do Qigong. If somebody told me, I don't know how to do this, that, and the meditation, just deep breath to and your belly button and just like this. Okay, so feel much better. I just told some some people, if you want to fight with somebody, you have to think 3 times, deep breathing, and you won't fight anymore because no use. But that's just something else. So each time I treating patients, before the patient, I always take a really good deep breathing and to help myself calm down. And also because we're locked down, I have more time in the morning to do exercise. This is like a luxury to me because I used to have to would rush to the school to sit in the office.
Yeah, that's right. Mm-hmm.
Right. I don't need to do that to rush. I just like I'm doing now. I don't need to drive a car to school. So I have more time to do exercise. Like today I did the exercise before I come to talk to you. So that's another one. And number 3, of course, you're seeking some food and herbal to help yourself. Okay, thank you.
Very nice. Yes. And I like what you were saying about the deep breathing. Sometimes that can really help, especially when you are wearing a mask, goggles, face shield. I could do everything personally, except for the face shield. I just could not make that work for myself. So the mask tends to be the one of the very best things, of course, to protect ourselves and others. But then how do we breathe and how do we get those deep breaths? So we were talking about a little bit of Qigong breathing. You can always look on YouTube videos for that as well. And at Five Branches University, we often will teach classes. So there are some online courses as well from Five Branches YouTube subscription. And I wanted to just say as well that for myself, I noticed that doing certain acupressure points, we got a question in the chat about acupressure points, that has been incredibly helpful for me. So for example, if you take a loose fist And where the tip of the pinky finger falls, that's going to be heart 8. And I will press that point on myself really whenever I'm getting anxious. You can do it bilaterally, both hands. And it's just where, when you make that loose fist, that the tip of the pinky finger falls. So you can do that for yourself, and you can combine it with a great point called P6, which is between these two tendons, about 2 inches or 3 finger widths from the crease of the wrist, like so. And if you press there with your index finger, with your thumb, and you hold it for about 10 seconds, you can actually do this one, P6, and then heart 8, and you go back and forth like so. And it can be really, really effective and helpful. So I wanted to share that that had been something that was really effective for myself. I do see also in the chat, we have a question about whether turmeric interferes with any prescription medications. And I will let Joanna speak to that as well. My understanding is that in general, because it is a food, that you do not have to worry about that. Most people would not eat enough turmeric just in their daily life to have any kind of problem with it. But if you are taking it as a concentrated supplement, take what it's recommended in terms of what the bottle says or what your practitioner says. You don't want to take, 3-5 times the amount because there can be sometimes with certain foods, also with Chinese herbs, whether blood thinning properties and so on. Those wouldn't really be an effect unless you take a whole lot of it. But we do want you to keep to that prescription label, whatever the label says, even if it's an over-the-counter item or a food item. We don't want you to have too much of it. Anything else on that in terms of turmeric, Joanna? Have you had any patients complain that it can interfere, or do you find it mostly pretty mild?
Yeah, I was just talking about the ear acupressure. That is the one, and the whole ear actually is the points of the human being body, like upside down baby on the ear, the pictures. So even if you don't know where the points is, I just told my patients to rub your whole ear before you sleep and do we call it happy ear rub. Okay, so just relax and rub at the back of the ear and the front and the crease and all. Just massage, and also earlobe is very important because the earlobe at that area above this is the brain points, which is very good to help to reduce your anxiety. And even I touch it now, I feel relaxed. So you can try that. It's very good. And also, like Gigi just said, Dr. Gigi just said about the points, the P6, which is 2 finger from this crease and over here. It's very good points to actually reduce the palpitation. Sometimes the anxiety will cause palpitation, and you can press it. When I was student, when I was studied in China, and we have a final exam, you had to present and talk to the teachers and the whole class. I always started getting anxious, get a palpitation. So I just pressed that point. Only needed like 15 seconds, I calmed it down. So you can try that. It's a very good point to calm spirit. Yeah, and of course there's many, many points we can do it. And also the herbs. Yeah, we talk about the turmerics. We talk about the turmerics because turmerics definitely can reduce the inflammation. Many of the anxiety, actually, if you reduce the body inflammation, you can calm down too. So, but I also will suggest another food, which is broccoli. The broccoli is very good herbal to help detox. Yeah, we know that. And I said herbal because in Chinese medicine, food is herbal, herbal is food. Just food that tastes good, herbal maybe somehow tastes not good. So this broccoli, whatever you want to cook, a steam and stir fry or whatever, it is good herbal to help you reduce inflammation and help calm down, and it's also detoxify. Okay, so that's my suggestion. And also, of course, I will talk about the tea. Yeah, the green tea. The green tea is, of course, some people, if you have a green tea, of course, they have some caffeine, right? So some green tea you can't drink after dinner. I always suggest you drink in the morning when you have your breakfast, right? That also cleansing and help calm. Thank you.
Very good. And I see a few more questions that we have. And Joanna, I think that you should speak to this one. We were speaking just a moment ago about turmeric. How much daily should a person take post-COVID? So if they have the syndrome of continuing to have symptoms after COVID, what amount would you suggest? Or in general, what would you recommend?
Oh, you talk about the people already having COVID? And
How much turmeric should they take, the Shengjiang?
yeah, I would start a very minimum, like a few, like, yeah, mg, in Chinese medicine, if you take the tablets, I see only 1 or 2 tablets in the 10 mg, something like that, very little started, because too much, turmeric also is very good, but also can help the calm spirit, but also you have to remember, if you take too much, it can hurt your stomach. If your pH of the stomach is not balanced, it's not good, right? So start from a little. Yeah, always, start from little, okay? Until you feel you can take a little bit more.
Very good. And that actually made me remember that there are certain things that can help with immunity, but just like Joanna was saying, you don't want to take too much. So certain of our herbs / foods, things like Shengjiang, which is the ginger, you can take, that every day in tea, but I wouldn't necessarily, take it 3 times a day. I would do a thin slice of ginger every day, hot water in a mug, and then you put the thin slice of ginger in there, because if you do too much, then you can start hurting the stomach lining. So many of these herbs, you really don't want to have them be overwhelming, and you really want to increase the amount of the foods and the herbs that you're doing that are helpful without actually harming, the stomach lining and so on. I do see a question here that we have, does Five Branches have videos or classes on acupressure? Well, many of our classes for the educational side do include acupressure, because you can always do an acupressure point instead of an acupuncture point. But for the public, one of the things we're working on is actually, we're doing it right now to introduce some of those different points. But to answer your question, we'll send an email at the very end that has maybe some more links to that. But I wanted to mention that for your immune system and for your anxiety, one of the best points that you can do is large intestine 4. Many people have heard of this point. And if you basically just take your hand and press the thumb to the side of the hand, almost like where you're playing rock, paper, scissors, but this is the paper. The point at the highest level of the mound is going to be large intestine 4. So you basically compress that point, really good to detox, helpful for the immune system, especially good for post-COVID syndrome. But one of the best things that you can do for your immune system, of course, is to get vaccinated. So many of us are already vaccinated, and that's such a pleasure because we don't have to worry about it as much, but we still wear the mask to protect others and ourselves. Even if the risk is low, the anxiety can be quite high, right? You want to make sure you're doing your exercise, your acupuncture, your acupressure, getting all of the Western side as well as the Eastern side, because that's a really good way to kind of give yourself the best hand up as possible. And Joanna, we have a question. What is the best time for the nervous system repair? To go to bed and to wake up?
Okay, that's a very good question. Actually, it's a very big question. I hope I can answer in a small, short time. For the time, time. So it's very important to everybody different. Yeah, I don't know if some people did a DNA test, right? They will tell you from your generation, when is a good time you should sleep, when you actually wake up, when, all these things, it's related with yourself. But of course, you don't want to force yourself. I have to wake up 5 o'clock. I have to sleep 8 o'clock p.m. That couple of my patients try that. You know what? You make it even more wake up early or sleep late and become, not anxiety. Yeah, it's like an anxiety type. How come I can't sleep? Oh, 8 o'clock I should sleep. That's not right. So I would say, depend on yourself. Of course, as a human being, especially like adults, if you can have 7 to 8 hours, very nice sleep, not disturbing too much, and you're pretty good. The next day you wake up and it's fresh, right? If you tussle around and think, that means you definitely needed some, treatment or herbs and to help yourself. But another thing that I want to say, don't force yourself. I have to wake up that unless you have job you have to do. That's something else, right? And also, I have another suggestion: that dinner, from dinner to your sleep, that a time, because after you eat, the digestion takes hours. It's not that you eat, I can sleep right away. You try that, you won't sleep, right? And also, and if you eat too much heavy food in the evening, dinner time, that is not happy because you will hurt your digestion system and also pancreas. So that's why you needed to um, judge yourself the food. Morning, in Chinese medicine, we say morning you have good food, and because you had to work the whole day and you needed something to help support your energy. And lunchtime you have quality food, which is have nutrition and help you to get nutrition. But evening, you should have lighter food because after you eat, you want to, relax and later go to bed. You don't want to have your machine of your stomach, machine, I'm talking about stomach, to work at night, you sleep. You never can sleep. You maybe have nightmare with it. So I would say, don't push too much. Say, I have to sleep that time. No, you only remember after your dinner and to your sleep, you need at least 3 hours. I would do 4 hours even better, right? But 3 hours. So for example, 7 o'clock, you eat, you might want to sleep after 10, right? Or something like that. You have to adjust it. Okay. And if you sleep at the 10, next morning you get up to 7, I think you'll be pretty good. Yeah. So that's what I said. By nature and by yourself, and also don't push too much, and also don't sleep too early after dinner. That's it.
Very good. Very good. And also they say that between those hours of about 11 p.m. and onward, you're doing a lot of cleansing internally. So that's in Chinese medicine, right around the gallbladder liver time, starting at 11 p.m. If you can be asleep, like Joanna said, sometimes people have night shift or different things like this. But if you can be asleep starting at 11 p.m. and then maybe you wake up 6, 7, 8 o'clock in the morning. Some of us with young kids, maybe earlier, maybe later, but the idea is that once you're asleep by 11, that you're actually going to benefit that kind of internal cleansing aspect. And just to return for one brief moment to the idea of boosting immunity while also reducing your anxiety, I wanted to mention that if you press right between the eyebrows, there's a point called yin tong, and that's really important in Chinese medicine for reducing your anxiety. You can actually pair that one, we're talking about acupressure here, with the point at the very vertex of the head governing point 20. So if you pair those two, maybe right before bed, you've got yin tong, you've got governing point 20, and that can actually be almost like a massage that you give yourself before bed. Really good for both boosting the immune system, bringing the energy up for the morning time, getting a good night's sleep, but then really kind of reducing your overall anxiety, which we've all had during the pandemic. And I had mentioned in the video a little bit briefly, but just for parents in particular, these things can be really important. I don't know how many of you became parents in 2020, but we did, not intending there to be a worldwide pandemic, but the amount of anxiety you might have as a new parent can be so high that that you really need to almost every day put multiple things into practice. Your acupressure, the foods, the different types of tea, like Joanna was saying, mint tea, lavender tea can be very soothing, and working on things from both the West and the East, and really trying to give yourself all of the options, all the benefits that you can. Very good. And now let's see, Joanna, would you like to add anything? It looks like we're just about done with the questions that we currently have, but we would love to take your questions via email after this, but go ahead and if you have anything to add.
Yes, I like to add one thing is, you know, we talk about a dinner, right? After dinner, the best thing is actually you don't sit down right away. That also, when you sit, you try, you get even worried. What am I going to do? That and you get your anxiety come back more. So after dinner, the best thing is sit. No, standing a little bit, wash your dishes, right? Then you should take a small walk. Yeah, I remember when I was living in Capitola area at that time. I was, and after dinner, I said I want to take a walk, and some neighbors saw me walking, said, "Hey, that's a good idea." So we become a neighbor walking and after dinner. So they told me because they know I'm acupuncturist. Said, "Oh, that's a good idea. I don't sit, watch TV right away. That also can help your digestion and relaxing your mind, and it's good exercise actually. If you don't want to walk outside, you can walk your backyard or your house and just do like 5 minutes walking. That would be very good too. Yeah.
Very good. Wonderful. Well, thank you all so much for joining us. We want you to get on with your Saturday and enjoy it. Maybe you take a walk, maybe you get some tea, lots of different things that you can do. Do some acupressure.
Yeah.
Thank you all so much for joining us, and we will continue this webinar series, and we'll have each month, we'll have one for professionals, one for the public, and we'd love to hear your suggestions and feedback as well. Thank you so much, really appreciate it. And 5branches.edu is our website, of course. Thank you.